Welcome to my presentation for Reconceptualizing Practice with Children and Youth. My name is Gemma. All work presented is my original work unless otherwise stated in the video. Today I will discuss out-of-home care in Australia and practice frameworks working with children aged 5 to 12 years. I would like to pause to acknowledge the traditional custodians of the land. I pay my respects to the traditional Aboriginal people of the Gold Coast, the Kumamuri people and their descendants. Out-of-home care is the care of children 0 to 17 years. It involves the placement of a child with alternate caregivers on a short or long-term basis. Informal care are arrangements made without intervention by statutory authorities or court. Formal care is a result of a child protection intervention or a care and protection court order due to abuse, neglect, or family violence. This table details the types of out-of-home care. Relative or kinship care. It is preferred to keep the child in their local community where possible, as support networks and extended family connections are protective factors. Familiar networks will reduce risk factors such as isolation. Foster care placements. Authorized carers are reimbursed and supported by approved agency, example Anglicare, or residential care with paid staff and supervision. Children are influenced by their environment. The first layer, the microsystem, comprises of their family, neighborhood, and school. Within this physical and social environment, the person is influenced by face-to-face interaction. Ideally, the family is a secure base. However, child maltreatment negatively impacts all domains of child's health and development, such as socio-emotional, physical, and mental health. The mesosystem involves the interrelations and linkages between two or more microsystems. Family conflict can lead to academic difficulties and anxiety at school, which is another microsystem. The exosystem is indirect influences such as social networks, local government, and school policies, example NAPLAN. Macrosystem is the largest social and cultural context. At this level, culture is the shared understandings, beliefs, and practices within society, teaching and appropriate behaviors to children. The chronosystem are patterns across a lifetime, affected by different time periods. An adult in the 1970s will have vastly different childhood experiences compared to a child born in 2004. Intergenerational trauma such as stolen generation or history of maltreatment impacts families. Societal changes such as economic crises and job loss. Natural disasters such as drought, floods, and earthquakes are contributing factors that cause conflict, poverty, and disruption. These interactions in fact affect a person's well-being and functioning. Therefore, nature, biology, and nurture environment cannot be separated as both concepts are interrelated. 1% of children have spent 5+ years in care. Young people are connected to the local community. Acknowledgement of their past, present, and future is vital. They will have relational ties to family and friends in the local community. Sadly, 26% of children in out-of-home care of 1 to 4 years. One of the most vulnerable age groups, the first 5 years is crucial for a child's social, emotional, and brain development. There are approximately 2,500 to 3,000 children in the 5 to 12 age group, which is a significant issue considering these are foundational primary school years. Table 2 shows the trends for 2013 to 2017. Unfortunately, there are increasing numbers of children admitted to out-of-home care from 40,000 to 47,000. My practice framework is child-centered practice, person-centered, involving the hierarchy of needs, and Bronfenbretter's ecological systems framework. The core values are empathy, compassion, empowerment, integrity, and social justice. This involves establishing therapeutic alliance and rapport with children, identification of needs through psychosocial assessment and intake, role modeling of appropriate behavior, and reinforcing positive behavior. Establishing a care network, unconditional commitment from consistent and responsive caregivers, particularly for those with a history of severe loss and trauma, and building resilience through social and community programs. Basic needs are at the bottom of the triangle. A person who is homeless, their priorities are at the foundational level: shelter, clothing, and food. A homeless family with children has increased risk, lack of secure housing, health, and relationships not being the priority. Rather, survival would take precedence over safety, health, employment, friendship, and connection to community, leading to disconnection from society. Mandatory reporting is required regarding substantial risk of harm, maltreatment, and types of abuse and domestic violence. These concerns can be reported to Department of Child Safety in Queensland and Department of Community Services in New South Wales. Person-centered emphasises the individual's own potential for growth and self-actualization rather than facilitator as the key to bring about positive change. Client-centered practice empowers the client to have choice, autonomy, and freedom to make their own decisions wherever possible. It is directed by the client rather than the therapist. therapist. For children, teach from the framework of making safe and responsible choices, indicative of the non-directive approach with client considered the expert in their life. Here is my developing practice framework demonstrated in the house metaphor. I am strongly influenced by a humanistic and person-centered framework focusing on strengths, protective factors, and finding solutions to minimize risk factors such as lack of social support or access to transport. The impact of foundational early childhood experiences is quite significant as well as previously discussed. The person-centered approach values include unconditional positive regard, empathy, understanding the situation from the individual's perspective, and demonstrating congruence, which means to be authentic in your practices and demonstrate integrity, despite challenges where a child is at risk of harm or potential harm. Tend to your client through non-judgmental responses and use reflective listening to understand and truly hear their concerns, hopes, and fears. In an emergency or crisis, be prepared to respond in a timely manner, following crisis intervention policies and procedures, as it is your duty of care to do so. The limits of confidentiality do not extend to disclosure of harm, knowledge of potential harm or harm to self. When working with families, check for identified red flags are the responsibility of practitioners. Risk factors of domestic violence, custody, legal issues, and substance use are conducted through gathering background data on risk and protective factors. Objective is to provide child-centered practice acting in the best interest for the child's safety, health, and well-being. Some recommendations is to provide access to appropriate support services, counseling, and community services. As part of effective case management, provide mentoring, support, and monitoring to the support workers to ensure the best outcomes for the child are achieved. Continuity of care is important. They need the stability and access to supportive carers. Foster care placements, they need to be supported with transitions and change. Consistency and routine should be implemented where possible. Case management involves establishing partnerships with community organizations and services and providing external referrals to assist children and carers. Parenting education classes and workshops have proven effective, such as Triple P parenting programs. Establishment of support groups and networks assist families in coping with change and adjustments to new care settings. Managing conflict within placement and continuity of care, combined with a stable environment, assist children to reduce their level of stress. For any further information, I provided this list of resources. Thank you for listening, and I hope you have enjoyed this presentation.